My name is Skyler Gibbs, and I chose to do my leadership symposium presentation on an article titled "Good Provider Communication Improves Antidepressant Adherence for Diabetes Patients." The authors of this article and study are Melissa Parker, Elise Adams, and Howard Moffett. Now, each of these authors are part of a much larger group at Kaiser Permanente. They belong to the Division of Research there. The reason I chose to focus my presentation and study on this article was because I like Kaiser Permanente's Division of Research group and their focal aim to understand the determinants of human wellness and improve overall quality and cost effectiveness of healthcare. So in the study, the objective was to determine whether shared decision making, patient-provider trust, and communication had any association with early stage and ongoing antidepressant adherence. Now, each study participant, which there were a total of 1,500 that were used in the study, rated the quality of communication with their primary care physician during a 12-month period. Researchers found that diabetic patients who did not feel included in the treatment decision-making process were more than twice as likely to never fill their prescription. In addition, the diabetic patients who experienced a lack of trust towards their provider were also 1/3 more likely to never refill their prescription after it was originally dispensed. These patients were also more likely to deviate from their overall treatment plans and not adhere to their medication instructions that the provider had given them. Now, these findings overall suggest that if patients trust their medical provider and feel included in the decision-making process, that they will be more likely to adhere to the treatment plan for antidepressant medication. Now, based on this study and article, I've come up with 5 different questions that I'm hoping everybody can contribute to and answer. First, why would a patient's level of trust towards their primary care provider be important in following medication instructions? Second, why would a relationship based on shared decision-making be important when rendering a health service of any kind? Third, how could primary care physicians evaluate how well they are using a shared decision-making model or process in their day-to-day workflow? Fourth, what types of issues, if any, might occur if providers allowed patients to dictate the majority of their treatment plan and medication use? Fifth, what are some things that patients do that can impede or stop trust from being established with their providers? So in brief, we went over a study that concluded that patients' perceptions of their relationships with providers, including lack of shared decision-making or trust, demonstrated strong associations with antidepressant non-adherence. I appreciate you listening to my presentation, and I look forward to your responses on the discussion board.